Yes.
No problem. Let me share with you this paperwork. I'm always afraid of utilizing all of them. I always want to remember the one.
Niliwaambia nini juu ya room like this?
It's acoustic sound.
Acoustically treated. And made room.
So, being the teachers we are, I think, and having gone through lots of information from where you started after post basic education, I'm sure you have so much with you. So what you just want is to share and maybe find omissions and commissions, some omissions or some commissions. I'll also learn from you. But basically this is what a typical audiological room. You know, audiology is a branch of medicine. But, and we have very many of them, pediatric, you know them, you did them theoretically. Yes, you know. Basically, audiology has two areas we focus on. One is otology and another one is speech pathology. Those are the two areas when we are keen on audiology, the ones we are interested as educational audiologists. Yes. Otology will be focusing on screening, diagnostic, and treatment of hearing disorders. The clinical audiologists will be doing it as not now hearing disorders, but ear disorders. Yes, because they will be in for things like otitis media and others, treatment and all medically. But for us, or educational audiologists, we want to just treat hearing disorders. When it comes to the speech area, we are interested in speech training, we are interested in rehabilitating the speech. So, because of otology, hearing disorders, and you know, to hear, you must have sound coming from somewhere.
Yes.
Moving through the air as an energy. And therefore reverberating the air around, pushing those air waves and the amplitude, if you did physics, in your ear, which has some curves. They're meant to, the pinna, it's meant to amplify the sound. Yes. So that if I'm talking like this, your ear receives it at that, and the second curve even receives it higher, then it goes onto the tympanic membrane. So when you enter into the audiology room, you will be required, for you to do that, you're required to do what you call otoscopy. Otoscopy now is where we take an equipment, and then actually some of them have lamps on their head. There's one in the car, I think I just drive and then left it there. Wanaweka kwa kichwa na angalia. That's the process. It's a procedure we call otoscopy. What are we looking for? Number one, is the ear is it having any malformation? We may have the completely absence of the ear canal. What condition is that? What do we call it? The complete absence of the ear canal. Go and look for it. Ask that one. What is it? Go and research. Students of masters do a lot of research. Can you check out what do we call it?
Absence of ear canal.
The complete absence of the ear canal. Meaning the tissue is filled with the tissue. You look in, you don't see an ear canal. Yes. There is also a complete absence of the pinna.
Yes.
Yes, you also look for that. What is that condition called?
Retractation.
Look for it. You have very serious libraries at Maseno University.
Malformation, but not what you say. Complete meaning hakuna.
Hakuna.
Yes, complete. They are children. Yes, we have seen them. We have attended to them. We have fixed other hearing aids that actually help them hear. The bone conductor hearing aid. Yes, for the complete absence. Yes. You get that one, it goes. Yes, the fellow hears again. Now, that's what we are looking, some of the things we are looking when you are doing otoscopy. We are also checking for foreign bodies. Maharagwe, beans, children with rubbers, anachukuna na rubber kanabaki hapo. That's what you call a foreign body. We are also, foreign bodies could also be insects, the place you sleep. It's not hygienically okay. Ulikula mkate ukawacha cockroaches kakuja zikafeed on and they end up in your ear.
Yeah. Exactly.
And there's normal serum in the ear is acidic. Isn't it?
Yeah.
And so if the cockroach leaks, it will surely die after some times. But not before you are disturbed. Of course, eh?
Yes.
Not before you are disturbed. The ear is very sensitive. The foreign bodies in. Then we have tumors. Tumors, you are checking for a tumor. And because you are so keen, as an education audiologist, you are also trying to find out if is the canal smooth and moving in smoothly, or do we have so much hair? Because the rehabilitation part of it, you will be interested in the hair we have people with the hair popping out in the ears.
Yeah.
Like Daktari, no. It is good, eh?
But the colors they are on top, not
Yes, on top everywhere. For men, you find them on the chest even. And when you touch the ones on the chest, you feel nice.
Yeah.
Then we also have, when you're looking in the ear, we are also interested in seeing if there is no foreign body, there's no clotted wax, there's also excess serum in the ear that is also bad. We may also want to see it. Then from excess serum in the ear, this excess serum collects dust and foreign material in the air. As small and minute as they are, they end up in the ear, and because there is serum, excess of it, you find that serum attracts and piles up into a clotted wax. That's how we get a clotted wax. So if a patient has, or a child in class, you check during otoscopy, you find there is excess serum, is a case of attention. Because serum is good. It cleanses the ear, is a protective mechanism within the ear. Yes. Then, as we do the otoscopy, we are also keen on looking at the eardrum or the tympanic membrane. Is the tympanic membrane intact or is it ruptured? Is it having a hole that has been occasioned maybe by an infection? And this time around we may be talking about otitis media. Infections like otitis media. Infections like otitis externa, you can easily see them on the walls of the delicate wall of the canal, leading to the tympanic membrane. At the tympanic membrane we have otitis media. We refer it otitis media with otorrhea if it is discharging, and especially from inside. So the breath of that person will be bad. Like if I had one, you will be wishing that we do this outside, not here, because you can't afford the odor. Yes, the odor. Hey, those odors are very good. But I find some men with that odor, but married with very beautiful wives. So the wives are in fact, they have adapted. It's the adaptation, isn't it?
Yes.
Very good. That's the beauty of nature. Now, The beauty of nature, Mother Nature is powerful. Sasa, around the eardrum, if we have not seen a rupture, which is a bad idea, if we have not seen a hole through, if we have not seen maybe a fresh wound that has resulted through trauma, maybe mtu ameweka mwingine slap mzuri sana, na collecting the air around and squeezing into the small ear canal can cause huge pressure that ruptures the ear.
Okay.
I have seen that. I asked Mama, this beautiful girl, now, hii damu naona ni fresh. Because again, the normal serum in the ear dries blood, fresh blood in the ear very fast. So it cannot come out. Yes. So if you've been traumatized and you feel pain, go check out.
Yeah.
It could be. If it's a child in school and he has spotted, don't take it easy. You can also, there's also another otoscope that is not